Welcome, and thanks for listening to this week's episode of
The Milk Production.
The Milk Production.
So, welcome back. We're so glad to have you. Last week we did not have you as our lovely co-host, so happy to have you back.
Great to be back. My name is Russ Rakestraw, co-host here at The Milk Production. Pretty much my role is comic relief and a little bit to show, the partner's role, which is important in the breastfeeding journey.
Look at you, talking the lingo.
I know. I am a father of 5, a purveyor of fine contact center technologies. Thank you, TalkDesk. And I like to play golf every now and then.
Yeah, that's good. We should do that. I like driving the cart, so it's like a perfect match.
It's perfect. That's what I need.
You need somebody to drive the cart.
I'm perfect on all my clubs. I'm not very good at driving the cart. So
I got you covered.
You got me covered. Good. Let's go.
I'm Megan Selke. I am your co-host on The Milk Production, lactation consultant. Recently reinvigorated my love for bird watching, something my dad and my grandfather got me and my sister into when we were young ones, but it has resurged inside of me like a light that was always dimly burning but is now ablaze.
Like the phoenix.
Yes. It is it's fun. It's lots of fun. I've been enjoying that in the backyard. Also, mother of 5 beautiful boys and big time reader. Love reading. Right now,
not to get too deep into our bedroom activities, but if I go like this to go snuggle with you at like 4:30 in the morning and there's no one on my side of the bed,
you know what I'm doing.
I know you're out there prepping for the morning birds. Maybe not 4:30, more like 5.
4:30 is a little early, but yeah, 5:30. That's totally reasonable.
Yeah.
You got to put the seeds out. You got to fill up the water bath,
of course,
or the bird bath.
God forbid their bird bath go. There's no other body of water anywhere near us.
Well, they might be near us, but I want them to come to my backyard. I want to draw them in.
Water.
Yeah. Yesterday, I had 18 varieties of birds in the backyard. So anyway, loving that lately. Got a bird bath over the week. Man, we did some good stuff over the weekend, didn't we? For me personally, my favorite parts were farmers market. Those beautiful teddy bear sunflowers.
Yeah.
Obviously the shishito peppers, potatoes, tomatoes, and all the other food that with goat cheese.
Yellow zucchini.
Jalapeno.
Which is different than
hummus,
summer squash.
Yellow zucchini. Man, we got some good food at the farmer's market. And then hanging the bird feeder, getting the bird seed, and getting the bird bath.
Yeah.
And I also have a solar energy run little pseudo fountain that goes in the bird bath to keep the water moving around. But we could we could just chat about that.
I worked
forever
with the boys on doing some work on the car, which, you could pay somebody to do it, but sitting down with a couple of teenage kids and showing them how to kind of maintain and work on a car I think provides a lot of value.
Well, Jackson was out there too. If you remember, he brought his vehicle out.
How could I forget about the 2-year-old?
Yeah.
He was working on his car.
Can you tell him about how much our oldest loved it, the 15-year-old?
He was really appreciative of it. He's the one that got really down and dirty, and we were changing brakes. And that is a dirty job.
He was covered head to toe.
He worked for 4 hours on the ground, covered head to toe in brake dust, and the only thing you could see was a smile.
Yeah.
He was happy as clam.
Yeah. Well, we were standing upright, working on the windshield wipers, which was that was
That's
a little bit of an
different
easier
story.
task.
Yeah, for sure. Hey, you change the brakes, we'll change the windshield wipers.
Yeah, exactly. So that was fun.
Equal distribution of work there.
Yeah. So anyway, good, productive, fulfilling weekend. Really enjoyed it. So we're back this week into the grind.
Indeed.
We should probably mention what the subject is about today. The topic is
nipple care. We don't do a whole lot of prep for this. I mean, Megan does. Well, by we, I mean we don't do a lot of prep, and so the only reason I knew that is because I looked over it just to give you guys a little
On my
hint.
notes, on my show
A
notes.
little show notes over here, teleprompter, if you will.
Although we actually used to do that in the military. We would, for some people, they liked their stuff written ahead of time, put on the prompter. And that was really nice. I mean, it was news style and it was 90 seconds.
Does the
So,
audience know that you were in public affair? You were a public affairs officer.
I don't know if they do. I feel like we talked about it.
So
in
she
an
does
episode,
like, you know, she did like TV production and interviews.
Yeah.
And so when she talks about those kind of things, know that it comes from a place of experience.
Yeah, it was fun. Most of the experience from my wonderful team just teaching me everything that they know, like from the civilian world and all that. Lots of really good, valuable training and education learned from them.
Awesome. So nipple care.
Back to the teleprompter. I get questions about nipple care a lot, and a mom that I recently worked with was asking about, yesterday actually, I was asking about hygiene for your nipples. And that's not the first time I've had that question. And
Does it change
well,
when you feed a baby? I mean, you're always going to wash your nipples, right? It's like, oh, I never wash my nipples, but now that I have a baby down there, I'm going to start washing.
well, actually, that's an interesting. So that was really the tip of the iceberg. We wanted to talk about. She wanted to talk about other things like creams and ointments and hydrogels and silver, and all the things. And part of it was, am I washing my nipples? Am I doing this kind of thing? And like with soap and water. Actually, we don't recommend washing your breasts with soap and water. Just warm water. If you want to run a wash with
me
other
guess
kind of
why.
thing. Good.
Like drying and irritation.
Well, yeah, you can get drying and irritation. That's something that I didn't think of. But also, when you put soaps and stuff like that are scented on your body, your baby is using the smell of your breast milk, or if you're in the colostrum
As a
phase.
cue?
Yeah, as a cue. Yeah, a cue. And so kind of to know where they
the poor
are
cue.
and to get excited about feeding.
Not
all
a
that kind
line
stuff.
of people.
No.
A different kind of cue.
Yeah, no, different kind of cue.
Not
Feeding cue. Yeah. So we're going to be talking about that today. So we're going to be talking about normal nipple pain, abnormal nipple pain, treatment for abnormal nipple pain, and then things that are not needed. The question that you asked is for a topic that comes up in the not needed section, which is you don't need to wash with soap and water after every feed.
Do you need to use butter?
What do you mean? Nipple butter?
Yeah, no, butter.
No.
Butter. I mean, it seems to me like when I smell butter, it's time to eat. That's all I'm saying. So maybe you should try to use butter.
Well, so what's interesting is the breast milk is actually reminiscent of the amniotic fluid. They have similar scents for babies. So especially in those early newborn days, they're like, oh, this is comforting. This is mom. This is food source. So it's actually really important to have that.
That's a good point. There's time to learn about butter.
Yeah.
They don't have to do it early.
Introducing solids is more the time to learn about butter.
Well, okay. I mean, I could make butter a liquid, but okay.
Yeah. Okay. But even we don't eat other liquids it's exclusive breast milk until 6
Right,
months, and you're
right, right,
introducing even other liquids.
Right. Gotcha. Okay, no butter.
So, like we said, we're going to talk about normal nipple pain, abnormal nipple pain, treatment for abnormal pain, and things that are not needed.
Okay.
So, the reason why we're talking about nipple pain in the nipple care conversation is because if you're having abnormal pain, you're going to need probably more care.
Okay.
But normal pain or normal discomfort, you may also want to use some of these tools.
That's the problem with pain.
How do you know what's normal?
It's so individualized. How do you know what's normal?
Well, what's really cool in the immediate postpartum phase is that women have just gone through something that's pretty tough. And yes, everybody's experiences are different. Some people are like, oh, that wasn't that bad. I could do that over and over again unmedicated. Some people are like, that was terrible. I had Pitocin. It was just an absolute, I had to do an I was vomiting. It's just such a spectrum of delivery pain. But even having gone through like those first contractions and stuff like that, we're sort of in a similar place, women, in that period, right? And So if we call that a level 10, or if they have something else that was harder, like they broke an arm or whatever, they have like something that's a level 10, right? I use the pain scale, which I always feel bad after having watched the Sackler documentaries about, but
They invented that.
yeah, exactly. But
So they could sell more opioids.
right. But I do find it helpful to tap into how women perceive their pain, because really, even if they don't have the same level of pain, tolerance, threshold, whatever, how they are perceiving it is actually more important anyway.
It's time for partner perspective. And I will tell you this. There have been times when Jackson has bitten down. I mean, I know that's kind of the most extreme, where I hear the similar sounds out of you that I heard out of you giving birth. So if giving birth is a 10, there are times when you can experience a full-on 10 during breastfeeding. Is that fair to say?
Yeah,
and again, that's from my perspective. I'm just basing it based on
You're right.
level of shriek.
Yes. Yeah.
Yes, that's not where's your pain 0 to 10. How intense was your shriek? And 10.
Yeah. Well, and the hard part is that, as a lactation consultant coming to help these moms, if I heard a shriek, for example, which would be a pretty tough situation, that's not common. But if I heard a shriek, for example, I haven't been with them during the delivery. So I don't know what their delivery shriek was.
I do. That's where a partner can
Exactly.
be valuable.
Exactly.
A partner can say to the lactation consultant, hey, I've heard that shriek before.
This
She
is
was
pretty painful. Yeah.
pushing a watermelon to the size of a lemon.
Right. Yeah. But I think the important takeaway here is whether it's my 10 or your 10 or her 10 or whoever's 10, it doesn't matter. It matters what they're perceiving it to be. So when you ask them to put a number to it, in cases where I see a bad latch, a lot of times I'll hear a 6 or a 7. A bad latch.
Okay.
Now, there are definitely instances where I see what looks like a pretty good latch and, they'll say like a 9.
So this isn't like a momentary, like when they bite down. This is like a constant 6
Great
or
question.
7.
So it can happen at the start, at the latch, and then it can improve within the first 30 to 60 seconds.
Okay.
As the nipple is stretching, and some of that is normal.
Mm-hmm.
However, the persistent pain is what we become particularly concerned about. But even that initial latch pain, if it's a 6 or a 7 or something like that, there are usually ways that you can try to encourage a deeper latch from the start that should alleviate some of that. So in the normal pain topic that we're talking about here, it is normal and or common to experience some discomfort from the stretching and the really frequent use of your nipples. And this, if you're first time mom, entirely new sensation, but for subsequent children that you breastfeed, it's also very normal to re-experience some discomfort and soreness as you reinitiate breastfeeding.
I have a question.
Yes.
Can you get blisters?
Yes.
I mean, I think about it like overuse. You use the word kind of, well, overuse is the wrong word, but constant use, right? And a lot of, almost anywhere else on the body, if it is under constant use, you're going to get blisters.
Yes.
So you could get blisters on your nipples.
You can get blisters, you can get
That
cracking, you
sounds
can
like
get
a
bleeding.
special kind of hell.
Now that moves, it is. That moves into the abnormal pain category. So in the normal pain category, back to that pain threshold, we're talking about like a 2 to 3 out of 10 on the pain scale. Normal, especially if it improves after the first 30 to 60 seconds in the latch. And especially if it's getting better rather than getting worse. And if you don't have any nipple damage, right? So you have all these factors that are like, yeah, this is sore. This is a different sensation. Don't love this, but it is improving. I'm feeling more comfortable and confident with the way that I'm latching baby. Baby is becoming better at latching on, et cetera, et cetera. And if all of those things are trending in the right direction, then the pain's fairly normal.
Yeah.
When you get into the abnormal pain, that's when things like blisters, cracking, bleeding, compression. So one of my old coworkers used to call it like it looks like a new tube of lipstick, like with a ridge, You want your nipple to look the same shape that it did when you put it in baby's mouth at the start of the feed. You want it to look like that at the end of the feed. Maybe more
Elongated.
or expanded. Yeah. But the general shape of it should be the same. If it goes in somewhat round and it comes out compressed, the latch was not deep enough. Or there's an oral anomaly or flatter nipples or, other things that you can troubleshoot. But the gist of that and sort of the root cause of that is that the nipple is not deep enough into the roof of baby's mouth to get a good, comfortable latch that protects the nipples. And why you should listen to your nipple pain is because
You can get blisters.
well, you can get blisters, but even, so pain is often not a big enough motivator for moms to listen to that nipple pain. I know that sounds crazy, but, I can't tell you how many times I've looked in the face of a mom who's like, this is 6 or 7 out of 10 pain, but it's okay. I'm going to push through. Their toes are curling, their shoulders are like hunched up, and they're invisible pain. They're like, I'm just going to do this for my baby. But it's really
That's that mom life.
yeah, I mean, that's just kind of, it's like, oh, well, this is, you hear breastfeeding horror stories, so you think, okay, this is normal. This is going to happen for a little bit, right? And again, understanding that difference between normal versus abnormal pain is going to be really important. The reason why you want to make sure you're listening to the pain is because it's an indicator that the nipple is being compressed. And so what that means for baby is, so even if you don't have damage and it's just the compression at first, or even if it's just changing shape, it's like babies drinking out of a straw that they're biting on versus a straw that's open and flowing.
Yeah.
So it can impede the amount of milk that baby's transferring. And that will affect their weight gain and signs of satiety and their sleep and subsequently the mom's sleep. And so it is really, really important to listen to that pain. It's not something that you just push through. And if you ever have any question about whether it's normal pain or abnormal pain, I know I say this a lot, but it truly, truly is the most important thing. Get lactation help early and often in the postnatal period. If you need an extra set of eyes to see if this is normal, do that early. Don't suffer for weeks. I did that with Everin for like six weeks or so, just like trying to grin and bear it. It was more like cry and bear it. And then this lactation consultant came and helped me within 5 minutes of being there, just deepening the latch. And so you can get a lot of pain and damage on your nipples, and you don't have to. Okay, so all of that set aside, right? You've got the normal pain, the abnormal pain, and then the treatment. The treatment is not just for your abnormal pain, like cracking and bleeding. You may need to do some of this nipple care and these treatment options, even if you're just a little sore. They can be helpful. And I'll talk about when some of these are indicated and when some of them are not. But do you mind passing me my little basket of tricks over there?
Of course.
Okay. So in preparation for the show, I pulled together a couple things. I don't typically just have a basket of nipple care options sitting around the house. This is actually Jackson's basket that he carries toys in up and down and around the house everywhere. So a couple treatment options. Obviously, a lot of people know about nipple creams. And so I'm going to pull out a couple different nipple creams here to kind of demonstrate. Can you hold my bag of goodies?
Of course.
Thank you. So you might have something like this. I mean, it doesn't matter what the brand is. This one is Lancino, and the ingredients are sunflower seed oil, olive oil, beeswax, coconut oil, shea butter, calendula, a couple other things anyway. The point is, Lancino is very commonly known for lanolin cream, but that is not the only kind of ointment they have. Some people do not like lanolin cream. It is an animal product. I think from sheep's, maybe. So they have all kinds of different brands that have Mama Earth comes to mind, stuff like that. And you just would take the lid off, do something like this, a small amount. It doesn't need to be anything like a lot. And you just would rub it in to whatever area is sore. Now, sometimes in cases where your nipple is pretty uncomfortable, even that kind of rubbing can make you a little nervous. If you want to do something like a cotton ball, you can just get it really good and covered. So you have like a really soft kind of thing like that. So this is an option. This is nice because you can do however much you want.
Yeah.
Now you can do the same thing here, right? But so the thing that I like about that more is that you can kind of just gauge.
Control it better.
Yeah, exactly. This, same idea. Now this is lanolin. So what I like about lanolin, I would use nipple creams and ointments at different times. So what I like about lanolin is it's a much thicker barrier. So I don't know if you're even going to be able to see this on the video, but the nipple cream and ointment is like very thin. It's moisturizing, it's soothing, that kind of thing. But the lanolin is very thick. And when I like that is when, say, for example, you're going out and you're going to be wearing a tighter bra or like a nursing tank top that you can put a breast pad in. Cover your nipples with the lanolin, like a good thick
What about
barrier.
the pad too? Can you put some on the pad?
You can put some on the pad as well. And that thick barrier, especially if you've had abnormal nipple pain, so cracking, bleeding, blistering, any sort of damage, all of that, you put a good thick barrier on it, and that will prevent the breast pad from sticking to it, certainly your shirt from sticking to it, anything rubbing against it. The lanolin is a good thick barrier. I brought this one as well because it's just a different brand, and I don't want you guys to think like I'm a Lancino person. This is Medela. They give these out at the hospital too. So you'll see something, a lot of times lanolin given out at the hospital. You probably got gifts prenatally of like nipple balm or nipple cream or something like that. We'll throw these back in there. And so for your abnormal nipple pain, you've got hydrogels. And the reason why I kept one of these out is because I want to make a really big deal about this. These two should not be used together. Lanolin, hydrogels should not be used together ever. And we'll talk about why, but I just want to foot stomp. It's okay if you're using lanolin one day and in that same day you want to switch over to hydrogels, but you need to completely remove this cream or the nipple ointment or whatever else you had on your nipple. You want to completely remove it. So in that case, cleaning the breast with a washcloth, soap if you have to, would be recommended. The only thing that you can use with hydrogels, and I still recommend using either with nipple ointment or with hydrogels, is expressed breast milk. So from a research perspective, your own breast milk is the best thing out there. You probably remember times when we've put my breast milk on like a scratch that Jackson had or something, and it's like straight Wolverine status, how quickly he heals. Same idea here, right? So it's got all those good things in it that help your nipple heal very quickly. So express a couple drops of your milk, rub that into your nipple, let that air dry. You can use that in combination with anything we're going to talk about today. But the key is to let it air dry. So once that's completely dry, then you can use the hydrogels. Now, I didn't use these, so these are going to be pretty new, but you kind of, they usually have these at the hospital, but you can also buy them online. These are you want to feel it? Have you ever felt one of these?
No, but how it looks is kind of how it feels.
Yeah, it's very soft, silicone, stretchy, a little sticky, but it doesn't leave like a sticky residue on your hands or anything like that. You put this in between your nipple and whatever outer garment you're wearing. Obviously, a t-shirt won't cut it, but if you have like a nursing tank top with a shelf bra, that'll be sufficient. Any sort of nursing bra that's going to hold it in place, that kind of thing. And that's why you don't want to have anything on your skin. The hydrogel itself is, from a research perspective, they use this with situations in like burn victims and stuff like that. So this type of material has been associated with faster healing of skin. So you want this to be making direct contact with things like blisters, cracking, bleeding, scabs, that kind of thing.
Yeah.
Think wounds when you're using this.
Okay.
Don't use this if you have soreness that could be resolved with something else, just because you don't need to. And if you get to the point when you need it, you want to have them available and it's kind of unnecessary. You can use this for, I mean, it depends on the package that you get, but I've seen one of them say like 7 days. They will be covered in lint very quickly.
Yeah.
You can wash them with warm water, but it doesn't get it off. I mean, it's got a sticky surface to it, so it attracts a lot of things.
Yeah.
You probably get 3 days of use out of this. And it's okay to use it for that long if you need to. Some people really like putting these in the refrigerator, getting them cold, and then putting them on.
Cooling effect, yeah.
Yeah, exactly. I mean, that'll only last for so long, but it would be
But it's soothing.
Yeah, exactly. So speaking of nipple care, we actually talked about doing nipple shields today, and I like to I like to recall that moment when you were talking about how you thought this was a nipple shield.
Well, it looks like a
It
shield.
does. It really does.
Looks like a shield. Look.
As you can see, this is an old. I don't use these. Certainly not anymore. It's a very old piece of silver. It's tarnished, but it is silver. Mm-hmm. And you get 2 of these, and you put these things in your bra, shelf bra, whatever your nursing top, whatever. And as you can see, it's got a good sort of structure to it.
Yeah, like a shield.
Like a shield would.
Type structure,
Yeah,
but
like a shield
not
would.
a shield.
Not a shield, because that name was already taken. So this, they have different brands, but this is a Silverette brand. Some people wonder, like, are these worth how expensive they are? Sometimes they can be relatively expensive as compared to other nipple care options.
Right.
Some people swear by them. Other people are like, hit or miss. I mean, silver is associated with faster healing,
Okay.
but some people get better luck with them than not. One of the
So
things...
is adamantium.
Yeah. Just saying.
This little nerd situation, Wolverine.
Oh, yeah, while we're talking about Wolverine's
Talking
quick
about
healing.
Wolverine, yeah. Sorry, go ahead.
So one of the things that I noticed about it personally when I was using it is that my milk would kind of pool in there, and I wasn't knowing it, and then I would go to take it off, and then it would kind of spill everywhere.
That could be a good thing, right?
It can
You
be
could
a
have
good
the
thing.
Healing milk.
It can absolutely be a good thing. It can also... I saw a mom out west, and she was using these and had a perfect ring on her skin, on the areola, that she was concerned was like a yeast infection from having used these. My guess is that it was probably a reaction to the silver, and she did not go on to have further yeast infections when she stopped using it. Rather, signs of a yeast infection when she did stop using it. But I say that to say, that can happen, and in her case, it was not good to have the milk sort of pooling up against in that situation.
Right.
She needed more air and like to let that heal and to stop using these. So just something to keep in mind. Same idea with the Silverettes, though. I mean, you can use your breast milk, but like a barrier cream is going to prevent the silver from really coming in contact with the damage. So try not to use as much of that. So my favorite, by far, my favorite product to tell people about is coconut oil. And
oh my gosh, she uses this for everything around the house.
I really do. I mean, I'm a lover of coconut oil, so I do have to say that I'm probably a little bit biased, right? But I find that straight coconut oil, this is anecdotal, right? I fully admit that. But the moms that I see with pretty severe nipple damage who use coconut oil see the fastest healing, truthfully. And so one of the moms that comes to mind, she had been giving herself nipple rest for 2 days. And so she was pumping, but not latching because the latch was sort of causing that really bad damage. And so she was giving herself nipple rest, and I came, and her nipples just looked terrible. Raw, still very red, pink in some areas, scabbed, just really, really in bad shape and still bleeding. And she did nipple oil, coconut oil for 2 days, and I came back and they were like healing. There was no more redness. It was just, it was...
Does blood in any way affect the baby?
No, good question.
For
They can nurse
taste
that.
or...
Yeah, certainly there's going to be a difference in the taste,
Yeah.
right? Because as we all know from like biting the inside of our mouth or something like that and having tasted blood, it's got that very irony flavor. But it's completely safe for babies.
Okay.
And in fact, some women, when they first start breastfeeding, have what, I hate the term, but it's called rusty pipe syndrome, where when that milk starts flowing, there's actually blood in the milk. So your first milk, which we would think of as like golden yellow colostrum, could be either rusty brown or pink because there's that blood in it. And it is completely safe, still recommended to give to baby because of all of those nutritional benefits that are not lost just because it's in there.
Yeah.
Good question. So, coconut oil, You can obviously use your fingers. If you don't like the idea of getting it on your fingers, just do this. Yes, it's a solid at room temperature, so you might have to warm it up with your finger, kind of rub it in, and then apply it to your nipple. Or you can use your finger, whatever you want. This is not as thick as Lancino, or not Lancino, I use the brand. This is not as thick as lanolin.
Yeah.
So in certain instances where the damage is bad and you really don't want anything pressed up against it, that might still be your better option.
Right.
Or you use this around the house when you can be mostly like loose shirts or no shirts.
Yeah.
And then when you have to go out and have something up against your breast, then you use something like
Right.
that. The other thing you can use this for is blebs, milk blebs. It looks like a drop of milk on the tip of your nipple. It looks like a white blister.
Okay.
Or like one of the sort of papules on your nipple has turned white and it's filled with milk. A lot of different theories about what causes it, but you can do the same thing here. Put coconut oil on this. Put the cotton ball right in your bra and just leave it there.
Yeah.
All day. Take it out at the end of the day, or apply more if you feel like it's there's not as much or it was soaked up or whatever. Apply more. Put it on the nipple, and that should be softened. It's completely fine to breastfeed through a bleb. And
Is it more painful or anything?
it shouldn't be. Now, some people start picking at it, and they're like,
then it becomes painful.
yeah, and you can get an infection that way and all that kind of stuff. So this is really sort of the tried and true way. It softens the skin. It helps baby clear it while they're breastfeeding. It's safe for baby to eat, all that good stuff. So I'm done with my coconut spiel. I will just say it was hilarious when I told one of the moms to use coconut oil. She goes, you mean like from Costco? And I laughed.
Sure.
I laughed so hard because I was like, well, yeah, actually from Costco. I got this from Costco 7 years ago, and I still working through it.
That's a long time.
Yeah, so I laughed that she said that because it absolutely is from Costco. My version is anyway, but obviously you don't have to get it from there. Olive oil, another great choice. As you can see, I mean, it's in the nipple balm that we were talking about earlier. Same idea. Tip it this way. That should be enough. Also very good for the skin. The thing that I love about coconut oil, I think it's more antimicrobial than something like olive oil, although I think olive oil still has antimicrobial effects.
Okay.
And the reason why I like antimicrobial about the coconut oil is because the damage on your nipple can lead to clogged ducts and mastitis. So the coconut oil is very antimicrobial. Why are you smiling?
I love all this knowledge you have.
Nipple care is important.
Nipple care.
So that's the big, and we can get rid of the treatment basket. Yeah. And then I got to get all this
Okay.
oil and cream rubbed into my
Oh,
hands.
you have to.
Yeah. Okay. So now that we've talked about all the treatment options, we want to also talk about what's not needed.
Okay.
One of the big myth busters that I want to talk about today is roughing up your nipples.
Okay.
You do not need to roughen up your nipples. That's something that's a lot of times passed down generationally. So maybe, our moms are told, oh, if you want to breastfeed, you got to get a towel. And once you're out of the shower, while your nipples are wet and soft, you have to take a towel and...
I was envisioning sandpaper, so towels are better anyway. Yeah.
Why would you say that?
I don't know.
Well, you think it sounds better,
I
but
guess that's what you kind of do to a surface before you paint it. You want to rough it up,
Yeah.
But we're not
Yeah.
painting nipples
No,
today,
we're not
are we?
painting it. And should everything go well, your nipples don't ever need to go through that roughing up period, right? So consider that myth busted. That does not work in terms of
Doesn't have any
positive
medical value.
Yeah, exactly. No medical value. It is completely a myth passed down from generation to generation to ward off spells. So the other thing that we talked about already is you do not need to wash your nipples like with soap and water. In that same vein, you don't need to wash them before and after feeds. Yeah, so those are the big things I wanted to talk about today on the topic of nipple care. So we talked about normal pain, what we know can sometimes happen. Yeah, exactly.
We talked about the shriek scale.
Yeah, shriek scale. It should be, your normal pain should be improving as breastfeeding is going on. No significant damage to report. Good deep latches. Baby gaining weight well, etc. Abnormal pain, that's going to be your cracking, bleeding, compression of your nipple, blistering, all that kind of stuff. Definitely look at the deep the depth of the latch, try to improve that, but also know that there might be oral or nipple anomalies going on, and normal or abnormal early and often lactation support. Treatment options for either situation, just for general nipple care, how to make yourself more comfortable. And then we also talked about that which is not needed, which is roughing up your nipples and washing your breasts before and after each
Or
feed.
using lanolin with hydrogel.
Yes, yeah. For back in the treatment option category, do not use lanolin with hydrogel. I'm glad you took that away. Or nipple cream or anything else with
The way
hydrogels.
you said you were stomping your foot. I pay attention when you stomp that foot.
I will remember that.
Mm-hmm.
So that's it. Those are the big topics that we wanted to talk about today.
Well, thanks for joining us today.
Yeah.
Yeah, I'm Russ Rakestraw as always, and
I'm Megan Selke.
we will see you next week. Like, subscribe, follow, comment, give us feedback.
Yes,
this
please.
is your time.
Yes,
I
please.
tell my customers this all the time. This is your time. Why not make it more valuable by us presenting things that you'd like to hear about? So comment and let us know what you'd like to hear about or what you'd like to see different or more of in the show.
Yes, please. We would very much welcome the feedback, trying to get you what you need.
Right.
Thank you.
See you next week.